So the next presentation is fibromyalgia, what is it? Now some of you will have some knowledge of this already. I'm sure some of you will have already gone away and researched certain resources that are available on different websites. But what we want to do is really try and direct you to appropriate resources and just give you a bit of a snapshot of what fibromyalgia is, what is it? So it's a long-term condition. I think that's important for you to know. It is long-term. It's not something that we can just get rid of. There is no cure. One of the main problems is that it causes global pain, and that's something that we'll be able to address in some of the other presentations later today. These are just a few of the different symptoms that you may present with. Some people will present with some people will present with all of them. There may be other symptoms as well that people present with. But typically, pain being one of the main symptoms, but there's many others, such as stiffness, poor sleep, forgetfulness, irritable bowel symptoms, headaches. People describe a brain fog or a sensitivity to things, poor concentration, and alongside that, anxieties and depression. So first of all, how do we get to this diagnosis? Well, generally it's a consultant rheumatologist that will have diagnosed you with fibromyalgia. And as I said before, there's no cure, and there's no specific blood test or investigation that can be used to diagnose the condition. It is a matter of elimination. Now this frustrates some people because it tends to imply that that's all we're left with, so that's what we're going to label it with. And actually that's not the case at all. It's really important to understand that you've been through the process of having lots of different investigations, and we can be confident in saying that there isn't anything else going on. That's not to say that that's what we're then left with. It's that actually you meet the criteria of fibromyalgia, and that's about the collection of symptoms that you present with. So what causes fibromyalgia? Well, to be honest, we don't really know. It's thought to be associated with the processing of pain by the brain and the nervous system. And for some reason, this process becomes a bit haywire. There tends to be a trigger, and that trigger can be mental health problems, it may be an illness, or it may be a trauma. And I think it's really important that you look back to see what may have been your trigger. It may not have been just one big event. It may be a combination of events that have happened over a period of time, and it's just escalated to the point where that's when the nervous system becomes sensitized. We also know that lots of things can make your symptoms worse. So poor sleep. If people don't sleep well, their pain is always worse. Sleep is often a symptom that people describe, but as I say, unless we can address the poor sleep, it's very difficult for you to move forward and manage your symptoms with pain, with the pacing, and really being able to lead your normal everyday life. So sleep is one thing that we really want to look into. And stress. Stress makes everything worse. Stress will always exacerbate your symptoms, and that's another thing that we want to try and look at to try and control better. So why me? It's the question people always ask. And really, I think it's important for you to know that you're not alone. Over 1.8 million people are diagnosed with fibromyalgia. It's a common condition. It does tend to be more women than men, and that may be that women tend to seek healthcare more so than men. And typically aged between 25 and 55, but that's not exclusive. But I think it's really important that you know there's other people out there experiencing similar problems as you. They have the same condition, and there is support available. So we want to look at what happens next. Well, we need to look at the treatment and support to help manage your symptoms, and this is the first step really, is providing you with these presentations and the resources available for you to then look at what's available and be able to manage your healthcare yourself in greater detail. But there are some resources which are useful for you to access, and this is the first one. I've kept the actual hyperlink there for you, but that's Fibromyalgia Action UK. They're a good resource. They've a wealth of resources in there, but also they can provide support for you. Another useful resource is on the website Versus Arthritis. They have a number of arthritis conditions available on that website, but the one I want you to focus on is fibromyalgia specifically. And again, it has the facts that are required for you to look at, and also what help is available for you.